When we speak of mechanism of injury, we need to understand that there are two parts. The mechanism is a force delivery system that's capable of causing an injury to the human body. We call the damage left behind a lesion or a derangement of tissue. Each mechanism then delivers a lesion that is consistent with the mechanism. A dog bite from a dog should not be mistaken for a gunshot wound or a burn, or vice versa. Now, one of the key questions that any patient involved in this mechanism should be asking is, what are the lesions that are consistently left behind with this mechanism, and does my doctor know what they are and how to work them up? You see, the lesions involved with this mechanism of an auto injury, if not understood by your doctor, can go undetected, and this can lead to a lifetime of pain and discomfort. So let's understand what the most common lesions in an auto trauma are. The first most common and often most serious lesion is called a spinal sprain. It occurs when the vertebral motion units are overwhelmed with force and the spinal ligaments are damaged. This particular finding is called a translation finding. We can also see what is called an angular finding. We see on this spine just how tightly packed together everything really is, right in and around the nerve. Now, in an auto collision, the vertebral bodies are forced into two different directions at the same time. This is called a shear force, and we can see it again right here. Two opposing vertebral bodies going in opposite directions cause an injury to the ligaments that hold the spine in alignment. One of the main spinal ligaments here is called the posterior longitudinal ligament, and it goes down the posterior vertebral bodies holding the spine in alignment. When it's damaged, it swells and irritates the nerve, causing loss of function with the nerve and usually pain. Now, one of the other things that we can see with this is damage to the joint, listed here, called the facet joint. When it's damaged, it too swells right into the nerve. This can be particularly painful. These sprains are best imaged with either standard x-rays with flexion extension views, or they're imaged with what is called digital motion x-rays. The images are then sent out to a group of radiologists that can upload them into a system and accurately measure the amount of joint play so that the treating doctor can more accurately determine just how sprained the spine is. The second most common lesion is called a disc herniation, and it's properly worked up with an MRI. The third lesion is a fracture, which is worked up with an x-ray and a CAT scan. The doctor that is not familiar with these technologies and how they assist with working these lesions up may of course put the patient at risk due to missed findings or delay in proper findings. An incomplete or delayed diagnosis can put you, the patient, at serious risk for long-term complaints that never actually go away. This is exactly why it's so important to find a doctor who knows how to properly diagnose and work up these spinal lesions that are associated with auto injuries. If you have any problems finding a doctor, please contact us, as we may be able to help.